Community Free Clinic has been helping keep people healthy for 25 years. My husband, George Lyles, helped start the clinic with Dr. David Lockhart. They would take patients. It didn't matter to them whether they were paid or not. They were concerned about too many people in this community that didn't have any health insurance.
The clinic has changed tremendously in the 25 years since it was started. Over time, it's expanded in hours and providers. We now have a full-service pharmacy, which we did not have back then. Of course, the facility is much different. Our pediatric physician founder would not recognize the place now.
We are the health care resource for adults in our community who are without any health insurance, who are actively looking for a medical provider, as well as pharmacy resources.
We do everything we can to not turn anyone away. I mean, some people come straight from the hospital and they've just been discharged from the hospital or from the emergency room and they have no medications. So, it's kind of hard to turn away a diabetic with no medications. We don't do that. We do our best not to.
When people want to try to take care of their own health and unfortunately can't afford it, this place helps them and it gives them back a bit of their self-esteem to make them feel a little bit more productive for themselves.
Unfortunately, nobody can operate without financial support. And for the Community Free Clinic, we realize some financial support through the volunteer resources that we use. We would not be here if it weren't for that volunteer component. We would not be here if it weren't for the community support component.
We have people that come in and volunteer to do whatever is necessary. We could not do it without them because our costs would be way too high.
We can't afford to employ as many people as we'd really like to, and so the fact that we do have nurses and providers who come and volunteer their time is crucial to the success here. But also we need monetary support as well. We keep our doors open. We have lots of bills to pay, and unfortunately we have needs that aren't fully met here in the clinic. I think the other thing is we know there are a lot more uninsured people out there, and if we could expand our hours and have enough money to employ some more people for the clinic, that we could be even more efficient and see a lot more people.
In our community, unfortunately, we do have a large number of our population who don't have access to a doctor, to a pharmacy. We are that safety net that allows someone to be able to have a medical condition or a health ailment treated, much like any and all of us would want for ourselves.
I was very sick. I thought I was gonna actually die. I didn't know which way to go. I guess my sugar was so high and I was so stressed and depressed. I had lost a son in August, and then my other son went into the Marine Corps, so my whole body was just falling apart. And I came here and these people are just real loving people. They're great people, and thank God I did, because they probably saved my life. So.
Y mayormente yo que pues estoy enfermo, ya no miro y tengo muchos problemas económicos, pero pues ni modo, hay que seguir adelante, ¿verdad?
We want our patients to feel like this is their medical home. We want them to know that we care for them, we are concerned about them, so that when patients come here, they know that they're family.
There's a lot more to being healthy than just taking medications. You certainly want to engage people in those other aspects of their lives and be sure that they're doing their part to make themselves healthier.
They've cared so much that it makes me care for myself more also. And that I do need help, that I can't do it by myself, so.
I don't just see you as a diabetic, and I don't just see you as with blood pressure. I don't see you as an organ. I see you as a holistic human being. That's the person, that human being that's in front of me, either in tears or worried and just terrified because they're so sick. That's the person that I need to address. That's the person I need to sit, talk to, hold their hand, maybe give them a hug, maybe, if they need it. With that, you get good outcomes. You really do. So if I'm gonna take care of you, I'm gonna take care of you, which means from soup to nuts, from the roots of your hair down to the tips of your toes. That's what I'm taking care of, the whole entire person.
¿Verdad? Yo estoy muy agradecido con todos ustedes y en la clínica aquí, que pues es una ayuda muy grande que nos dan a todos nosotros los que no tenemos.
Having this place to come to was, the best thing that happened to me.
Health happens here.
La salud ocurre aquí.
Health happens here.
Health happens here.
Health happens here.